These are our stories.
Good morning, and welcome to this venipuncture refresher course. And we have picked 3 subjects who represent a broad cross-section of knowledge and good practice in this area. Subject 1 is completely up to date with standard precautions. Subject 2 is a little bit behind the times, and Subject 3 is from the Dark Ages. Now then, you've all been asked to take blood from a patient who at the last moment informs you that they are HIV positive with an undetectable viral load. What is the first thing you do?
I reassure the patient that this won't affect the procedure and tell her that I will simply draw blood in the normal fashion, taking the same care that I would with any patient.
Excellent. Subject 2.
I'd buzz for this one. Get her to do it.
I see. And Subject 3.
Oh, no. I'm hiding in the supply cupboard till the manky buggers after the ward.
Okay. Can I just ask you all how you keep up to date with the best professional practice?
Well, I make sure I read departmental standard operating procedures, attend any core training, and I've read the online manual for the prevention and control of infection.
I try to keep up to date with me.
Smart ass.
And number 2, how do you keep up to date?
I keep my ears open, pick things up as I go. And I'm always watching old episodes of House. So just like him, when I don't know what the hell's wrong with someone, I just say, sarcoidosis, bring on the steroids.
That's what I do, isn't it?
Oh dear. And number 3, what is your routine for staying abreast of... How do you keep up to date?
Away going, geese piece. I barely opened my book when I was doing my training at college. It came as a shock to me in 3rd year when they actually had a library.
Okay. Let's just move on from theory to practice. You have a patient who is self-identified as having HIV with an undetectable viral load.
Tell you, I'm out of there.
And you have no choice but to take the blood. You each have an assortment of equipment in the boxes behind. I would like you all now to show me how you'd prepare to take the blood. Subject 1. 1 pair of gloves.
That's all that's required for any patient, with or without HIV and irrespective of viral load.
Subject 2. You feel goggles and a mask are necessary?
Too bloody right.
And how many pairs of gloves?
Just the 2, but that's only because there was only 2 in the box.
Apart from making the process more difficult, just how do you think those extra and quite unnecessary precautions might make the patient feel?
Don't know, don't care. All I know is it makes me feel a hell of a lot better.
I see. And subject 3? Number 3, just how do you expect to take blood whilst wearing boxing gloves?
Don't be daft. These aren't for taking blood. These are for fighting my way off the ward so I can get as far away from that infected woman as soon as.
And the snorkel?
That's for when I jump into the pond to clean myself off. Can't be too careful around these infected guys. Know what I mean? So have I passed?
Yes, you have.
Really? What'd I get?
4 weeks retraining to bring you back out of the Dark Ages.
No one deserves or wants to become infected. HIV doesn't discriminate, neither should you.